Hello, this is Dr. Mashika, optometrist for over 25 years, speaker and Amazon best-selling author. So today I want to share with you that eye injuries matter. So just a quick story. You are seeing me today with my glasses on because yesterday I actually had an eye injury myself. I was lifting something off the shelf and a box of alcohol wipes poked me in the eye at the other office where I worked. I'm fine, but it's always best to not put contact lenses in when you've had any kind of injury. So I'm just resting my eye. Perfectly fine today. But again, I want to share with you that eye injuries matter, and I have 5 things that I do want to share with you. The first thing is, if you have an eye injury, you want to call the office where you are going to see the doctor and let the receptionist know that you actually have had an eye injury. That's very important because when we schedule patients, we may schedule in different slots. We schedule for sort of like medical emergencies, urgencies, and routines. So make sure to let the receptionist know at the office where you're going that you actually have had an eye injury. The second thing is when you do go into the optometrist office for an eye injury, it is considered a medical visit. So do not go in expecting to get a prescription for glasses or for contacts or even to do an exam that would result in that. This is just considered a medical visit. So if you have medical insurance, then the receptionist, when you walk in, will ask you for your medical card. The third thing is you want to make sure that you describe to the doctor everything, every detail that happened with that eye injury. And what that does is it helps the doctor in determining what tests they may have to do. Sometimes if it is considered an eye infection, the doctor may have to order a culture, or, if it was an injury like what I sustained and I didn't have another doctor in the office to look at me, they may put dye into your eye to determine how bad the scratch is, or just to determine if there is a cornea scratch. The fourth thing is, if you are prescribed drops, antibiotics, steroids, even oral medication for your eye injury, make sure to fill that prescription as soon as possible so that your eye can begin healing. And then the fifth thing is, make sure before you leave the office to schedule